This week, some new information came out talking about high blood pressure among teenagers and children. It appears to be on the rise. New guidelines encourage doctors to be on the lookout for signs of the condition in their young patients. High blood pressure is mostly a silent disease with no visible symptoms, yet it can have long-term health consequences, including cardiovascular problems. Let's talk about this with Dr. Scot Ackerman, the medical director from the Ackerman Cancer Center. So, Doc, let's talk about this uptick. They did change the guidelines. Does that have something to do with it, or is it really a problem that our kids are grappling with more?
I think it's really a problem that our kids are grappling with more. The change of guidelines is a reaction to the increase in incidence of hypertension in children and young adults. We used to see an incidence of about 1 or 2% kids and young adults would have hypertension, and now we're seeing it's about 3%.
It's often called the silent killer, and the reality is, and I mentioned this a couple of seconds ago, there are often no symptoms that are present. How do you know?
Well, you know by checking one's blood pressure. So the new guidelines are that we should encourage our pediatricians to get a blood pressure check on children beginning at age 3 and then doing it annually. That way you can identify someone that might have hypertension, a child that might have hypertension before it becomes a problem, number one. Number two, you can identify a trend and then maybe intervene and make some lifestyle changes that could affect the hypertension and minimize the risk of developing long-term problems.
So it's prudent then when mom and dad takes the child to their annual checkup that they say, Doc, let's just check their blood pressure to be sure.
Right. I encourage all parents to have that conversation with their pediatricians. The pediatricians are given these guidelines, but it's a two-way street. You know, I think that the public needs to speak to their physician and speak and talk about hypertension in children and make sure that the blood pressure is checked annually.
Risk factors.
So there are two sets of risk factors. One is lifestyle risk factors, and one is risk factors that are that you really can't control. So the ones you can't control, this what we call secondary hypertension, is caused by some health condition you may already have. If someone has kidney disease or heart disease or hyperthyroidism or adrenal disorders, these things could lead to hypertension. And if you detect hypertension in a child or young adult, it might be because of these disorders, and you can identify these disorders and nip it in the bud and treat it before things get out of control and becomes a problem.
That leads me to my next question. How do you deal with it?
So the other type of hypertension is related to obesity and diet and those sort of things. So once you identify hypertension, if you identify the root cause of that hypertension, be it an underlying disease, or maybe it's a lifestyle thing such as obesity, high salt diet, high fatty diet, those sort of things, you can do something to intervene and reverse the hypertension or prevent it from getting worse or prevent it becoming serious. In some instances, we need to treat childhood hypertension like we treat adult hypertension with antihypertensive medications. You don't want to do that, but it's better to be on the antihypertensive medications than have hypertension run rampant and cause long-term problems for the child when they become an adult.
But like my doctor tells me, if you adapt your lifestyle, you can almost better deal with hypertension, and it's the same for our kids.
Oh, absolutely. Adapting a lifestyle, reducing obesity, reducing sugars in the diet, reducing salts and those sort of things, having more exercise and more physical activity and exercise will minimize one's risk of hypertension and can actually reverse hypertension in someone who has it.
So we have to set an example for our kids. A lot of important information here to absorb. So I'll tell you what, I'm going to post this interview on news4jax.com. You'll be able to access it if you go to the morning show page and down to videos by about 10:30, 11 o'clock this morning. Doc, always a pleasure.
Thank you.
Be right back.